And there was some questions and things brought forward by the farm industry saying, we need some clear messaging of how this is going to happen.
Ontario's top doctor says on-site testing of farm workers was paused because farm owners were confused. New detail tonight about what's happening in the agri-farm sector, where nearly half of the COVID-19 cases in Windsor-Essex are coming from. A live look outside now, 35 right now with the humidex. Rain was a nice break last night. Keep your eyes to the sky today. Running out of time to spot that comet that's been poking its way across the evening skies. We'll ask Colette Kennedy if it's a clear forecast tonight. I'm Chris Hensing. Thanks for joining us. A continued spike in COVID-19 cases here in Windsor-Essex. We start tonight in the agri-farm sector. Ontario's Chief Medical Officer of Health says that on-site COVID testing for farms in Windsor-Essex was paused by Ontario Health for 2 weeks because farm owners were confused. CBC's Jason Vio has more.
The communication to the farm owners was a bit confusing.
So, Ontario's Chief Medical Officer of Health says they paused on-site testing for at least 2 weeks. CBC News reported that 19 of the more than 170 agriculture operations participated in on-site testing. Just yesterday, a toolkit was posted online by the government so farmers can get some clarity, and he says testing will restart soon.
You can see what the expectations are and understand what impact it might have on the operation of the farm and the working and the staff, etc. And of course, making sure that's communicated, perhaps in Spanish or other language, to your workers so they understand what it means as well, because it is their choice to get tested or not get tested.
He also says there's concern for workers as the harvest season will only get busier from here, and the goal is to test all farm workers. Leamington's assessment center is also set to reopen possibly next week. Erie Shores Healthcare says that will happen when farms are identified by the Ministry of Agriculture, Food and Rural Affairs and Ontario Health in a sufficient number to warrant reopening and redeploying staff. And after that testing, if they are positive for COVID-19 or need to isolate because it's a possibility, they're taken to hotels. Yesterday, we told you about 2 in Windsor-Essex, including this Holiday Inn on Huron Church Road. The Red Cross is caring for 140 migrant workers who are isolating, but former MP Tracy Ramsey says there are about 150 more who are in hotels under the supervision of their employer.
First of all, who's in charge? Who's overseeing this is clear as mud. What we do know of the folks that are out in the hotels and motels that are not under the direction of the Red Cross, they are on their own. So they have their employers that are in contact with them, and some of them are receiving some food from their employers and some aren't.
On Tuesday, Ramsey says her community group of volunteers distributed 300 food boxes to migrant workers isolating in hotels, and she says it wasn't enough. The province has also deployed the Emergency Medical Assistance Team. They're here to provide incident management support and coordination to the health sector in Windsor-Essex for the next 2 to 3 weeks. Jason Vio, CBC News, Windsor.
People who live in Windsor-Essex County are at the highest risk in the province of coming into contact with someone who can transmit the COVID-19 virus. That's according to one biostatistician who's been crunching the numbers put forward by Public Health Ontario. Our Jacob Barker spoke with him today. Joins us now live. Jacob, what can you tell us about those findings?
Yeah, Chris, well, I'm out here in public, and as you can see, there's a patio full of people, and the biostatistician Ryan Ingram that I spoke with today says this is the place in the province where you have the highest risk of contracting COVID-19 if you're out in public. He is not looking at the number of active cases, but the number of people that are infectious. And well, the data that he's relying on comes from Public Health Ontario. He does say that it does take into account some assumptions, such as the people who have such as forecasting the number of people who have cases that might have been missed. He says this is a region where you'd have the greatest chance of contracting the virus, depending on how many people are around you. And depending on what that group is, whether it's a group, an event, or a gathering, the chances of being around somebody who has transmittable COVID-19 goes up. If you're in Windsor-Essex County and come into contact with 10 people, there's a 6.6% chance that someone with the virus will be there. Add a few more, and that jumps to 10%. If there's 25 people, that jumps to nearly 16%. At 50 people, there's almost a 30% chance. 100 people means almost a 50% chance. 250 people means an 81.8% chance. And anything over 1,000 people means that there's a 99.9% chance that there will be someone around you that can transmit COVID-19.
I think what's told is that there is a lot of asymptomatic cases which are out there, and not just Windsor-Essex County, but all of Ontario as well. I think if we did the same kind of targeted testing that we had in Windsor, we definitely find more cases elsewhere.
That targeted testing he's talking about is the agri-farm sector, where people are more prone to getting the virus because of the conditions they are living in. Cases in Kingsville and Leamington do currently account for the majority in the region. He also makes the point that the data he uses is for the entire region, so in your particular neighborhood or area, it might be higher or lower than these numbers. But it does make clear the need for following protocols are of utmost importance if we're going to see the rate of spread come down. Right now, for every case of COVID-19 in the community, it creates 1.3 more cases. To really see the rate of spread slow down or even stop, that number needs to come down.
So really what's important is that we're masking up, we're social distancing, we're doing other social mitigating things so that we can keep that number at or under 1.
Now, Jacob, I've heard from a few people concerned about the new cases that are popping up. We've heard it from officials as well. What are you hearing?
Well, it is concerning for sure. Over the last couple of days, a couple of weeks, we've seen an uptick in new cases spread in the community here in Windsor-Essex County. Over the past couple of days, the health unit has attributed 27 new cases to community spread. And some that we spoke with say they're being more careful when they go out into public. Others say that other people need to step up.
I do my part, but not everybody does, do they? Because if we all did from beginning, the COVID shouldn't be here now.
It means more and more people aren't doing what they're supposed to, and more people are going to get sick, and I think it's so terrible.
I want to go back to school soon, and honestly, the online learning, it's affecting all of our grades because my grade dropped. I was at like an 85 probably, and now I'm at like a 70. So it's not helping with that.
So I think that what this shows, Chris, is that while things are opening up again, people really do need to stay safe and keep doing those practices such as keeping a distance, wearing a mask, and that's something that both people we spoke on the street and people in the scientific community can agree on. Chris.
Thanks, Jacob. The CBC's Jacob Parker live in downtown tonight. Now, that continued daily double-digit increase of cases in Windsor-Essex has been noted by Ontario's health minister. On Monday, the province decides who enters stage 3. And today, the CBC's Katie Fraser, who's been on the health unit briefing every morning during the pandemic, has a keen eye on the curve of COVID-19 cases here in the community.
A few months ago, even a few weeks ago, we were talking about flattening the curve here in Windsor-Essex, but the curve is definitely not looking flat anymore. Are you concerned that we've moved into stage 2 too quickly?
Well, I guess I wouldn't say that we, the timing about stage 2, because obviously the information that we had at that time and the pattern and the trajectory that where we were heading was fairly stable. Even though we are seeing right now cases, it is still fairly contained in the agri-farm sector mainly. And also many of these cases that we are finding right now, they're all linked with the original cases. So there is some comfort in that, but obviously moving to stage 2 opens up more opportunity for people to congregate, more businesses to open, and more likelihood of transmission. So even in areas that have done relatively or very well in the province and in other jurisdictions, what they are seeing is they're also seeing an increase with the stage 2.
And I mean, you mentioned that a lot of those cases are in the farming community, but we are seeing those increases in community spread as well. So is this something that is going to keep us held back in stage 2?
Well, purely looking at the numbers, I guess the number are there, and one of the major criteria for the province to move any community to stage to the next stage is to look at those numbers. The numbers that we are seeing right now is definitely higher than pretty much the province, to the provincial average, and many other areas of the province. So I think that number will definitely be something that may come into play in making any decisions to move us forward.
There's 2 confirmed outbreaks of COVID-19 at a pair of Walmart stores here in Windsor. A spokesperson for the company confirmed that 4 employees have tested positive at 2 different Walmart locations. 3 are at the East Windsor store on Tecumseh Road. The company says that the employees last worked July 14th, July 12th, and July 2nd, respectively. And there's another employee that tested positive at the South Windsor location. They've not been on site since July 1st. The Walmart spokesperson also said that out of an abundance of caution, associates identified as being in close, prolonged contact have been directed to self-isolate. We also have regular enhanced cleaning in the stores and other social distancing measures. We are in contact with public health about the cases. Essential workers on the front lines of the COVID-19 pandemic have risked their own safety to get the job done. But when it comes to them getting health care, it's a different story. As Tashana Reed tells us, some are told they pose a health threat.
It was ICU nurse Hinda Hassan's first week off since this pandemic started. She booked an appointment with a chiropractor and massage therapist, but shortly after arrival, she was turned away.
It was a little disappointing, and you could see there was a huge informational gap.
At the clinic, Hassan filled out a COVID screening checklist, identifying she has contact with COVID-19 patients, wears PPE on the job, and has no symptoms. But the clinic told her they can't treat her unless she does a COVID test.
I thought that was crazy, because what reassures you? Because if I have the test today, tomorrow I go back to work, then what?
According to Ontario's Ministry of Health guidelines for healthcare providers, Hassan should have been able to receive treatment because she wears PPE during exposure and had no symptoms.
If you needed my service, I can't say, hey, you're high risk, I'm sorry, I can't take care of you. But then here you are, you're denying me those rights.
Clorox wipes. Yeah, tons of those.
Long-haul truck driver Bob Haynes has run into issues too.
I can't even go see my doctor. My doctor won't even see me.
Haynes regularly travels to the U.S. and says he can't get a doctor's appointment, and his wife's dentist canceled a recent appointment unless she isolates for 14 days.
I would like to see them treat us a little more fairly.
The Canadian Trucking Alliance says it's looking into how widespread the issue is.
Asking truck drivers to quarantine for 14 days before they get medical attention is, quite frankly, unacceptable.
The Royal College of Dental Surgeons says unless the person is in need of urgent care, some patients can be asked to do a test or isolate. As for Hassan, the health clinic apologized and updated their protocol for health workers. She plans to rebook. Tashana Reed, CBC News, Toronto.
This pandemic has thrown everyone for a loop. I know it's gotten me out a bit more than usual. Can't go to the gym, but let's be honest, never really went before. A Windsor-based researcher, though, they want to know how this pandemic has affected our fitness. More than 130 adults, mostly in Windsor, are part of a new study. A study that's centered around changes in the amount of steps that people are taking every day. As the CBC's Sanjay Maru shows us, it also highlights some of the creative ways people are finding to stay fit.
At the start of the lockdown, all we heard was one message.
Go home and stay home.
Right when the pandemic hit, most people decreased their physical activity, and we saw that by about 1,000 steps per day.
Not an insignificant amount by any stretch. I'll prove it. Almost 1.5 times around these 4 blocks, took about 10 minutes exactly to walk 1,000 steps, starting on the corner of University and Karen toward Pitt Street, then down Bruce Avenue. So as this pandemic has continued, have people's fitness habits gotten any better?
Since then, and as of today, because we've looked at them or we're following them for the few months, is that although they had a dip in physical activity, it really has gone back up to their pre-pandemic levels.
But people aren't necessarily just walking more, they're also using household items to stay fit, like taking bleach bottles, in some cases filling them up with sand and using them as dumbbells. And according to Woodruff, some people have even reported using their couch or a chair at home to do tricep dips. And one participant in the study even says she's been able to rediscover her love of biking, something she hasn't been able to do in quite some time.
What I found by cycling, I found that that's helped me, and I've been exploring lots of new trails in the area. I've also found that cycling with friends and family has helped me keep motivated and kind of accountable to staying involved and staying active.
Researchers believe people's fitness habits will get back to normal as this pandemic continues, especially as gyms start to reopen. But for those struggling to get off the couch, the suggestions are pretty simple. Limit your screen time, and you can even set reminders on your phone to tell you when to get your steps in. Sanjay Maru, CBC News, Windsor.
A neat look at how we've all tried to stay a little fit during this very, very difficult time for some of us. And we have another look at the sky tonight for a chance to see that comet. It's going to be as close as it will be tonight, and we'll see if Colette Kennedy is going to give us a clear sky to take a peek at it. That's next. And joining us now for a live look at the weather is Colette Kennedy. Colette, I want to start with the sky here. Yvette, one of our colleagues, said that she found that comet. She was able to see it yesterday. My mom and dad saw it on the weekend. Have you seen it?
Okay, no, I haven't seen it. Have you seen it?
I haven't seen it yet either. My eyes are peeled, but I've just not looked at the right time, I don't think.
Well, and it does seem like our days are getting numbered for the best viewing, right? So tonight might be the night. And what's great is that it's sort of now the best time for viewing is right after the sun sets. And the sun's setting for us tonight about 9:01, so just a little bit after that.
Okay.
We need to look towards the Big Dipper. So northwest sky and just a little south of the Big Dipper is, I guess, where we need to be looking. But you got to get away from the lights of the city, right?
Do we have clear skies, or are the clouds going to be there?
Well, you know, it's going to be a little hit and miss. But we're going to be doing okay. Overnight, we're going to get into some fog. So it's nice that it's going to be, you know, just kind of after sundown that we have our best viewing of this comet. It's kind of cool that it was only discovered back in March of this year. And it's not going to, it's almost 7,000 years before it comes back again. So it was only discovered and just in time, I guess, for us, right? Current temperatures right here, let's get into this. 25 as well for Chatham-Kent. We have some humidity, 32, 31, so it's not as humid, and tomorrow not as humid, and then it's coming back in the weekend, and we'll likely get into some of our heat warnings, those coming back as well. Now, looks pretty good, doesn't it, for this chance to be seeing our comet in the OI, so just know about that. Now, I did mention, see this coming in off the lake through the overnight hours and into tomorrow morning, so maybe morning hours, a bit of reduced visibility before the sun burns that off, so be aware of that, some morning cloud and a little bit of patchy fog, but then things looking pretty good, kind of a mix of sun and cloud, but then more sun in there for our Friday. Now, tonight, the temperature's looking like this, 17 for our low. Tomorrow afternoon, enjoy that the temperatures are in the upper 20s, and that the Humidex value is just at 33, because like I say, the changes are going to be coming as we go into the weekend, and those temperatures are going to be spiking. We're going to see the Humidex values going up there towards 40 or even getting into the low 40s, and that's why I think the heat warnings are going to be coming back. And as we go towards Monday, we're going to see some active weather coming back and the risk of severe. And just before I go to the 5-day, while I'm on that note, I do want to update you that from back on the 19th, last Sunday, another tornado now confirmed, so that puts the total from Sunday at 6. It means on the season, it puts our total now at 19. So one event back in June on the 10th, 10 tornadoes. From last Sunday, 6. So 16 of those from just 2 events, and 19 overall, almost to 20 on the season, a very active year. This is what I'm talking about, Chris, for the weekend with those temperatures going up, and Monday we'll be watching for some active or possibly severe weather on that day. Busy season.
Absolutely. And Monday is something we can worry about on Sunday night. Those Sunday scaries, they've never been worse.
Tonight, just worry about seeing the comet.
Absolutely. Thanks, Colette.
You're welcome.
Now, coming up, this might be something that's affected you. The wait times for surgery in the province, it's shifted because of COVID-19. We'll have an update on that next. A life-size 3D model of COVID-19 patients' lungs could give doctors around the world a detailed understanding of the damage that's done at the height of the infection. Now, the model was drawn from the CT scan of a patient in Belfast 2 weeks into the infection. The patient survived as doctors gained new insight into what exactly the virus does. The yellow in the model is inflammatory pus and scar tissue in the airways. It's limiting oxygen of the blood. Now, splitting the model lungs into parts allowed medics to see how deep that infection gets. We're also getting an early idea of the impact COVID-19 has had on surgical wait times in the province. June was the first full month that elective surgeries were being done since the state of emergency put them on hold. Now, the backlog, it's so bad that experts say if we don't speed up the system, it could take years to clear. Lauren Pelly has a story.
Like many people in the pandemic, Patty Anacleto has been trying to stay calm. But in February, the Brampton resident started feeling a strange new pain.
What it felt like I was having pulsing or spasm in my chest and down my throat, and then there was just some general pain. I couldn't lay down to sleep.
It turned out to be gallstones, and Anacleto needs surgery to remove her gallbladder.
It's very unsettling just waiting, knowing I could have a gallstone go off tomorrow and I would be in pain again, and there's really nothing I can do.
Now she's stuck waiting, like thousands of other Ontarians, not knowing when she'll get into an operating room.
People are waiting in pain, people are waiting in uncertainty, some people's health declines while they're waiting.
The big backlog means delays across the board. People needing cancer surgeries typically waited 50 days last summer, but the wait time was close to double that this June. A similar jump in waits for neurosurgeries, going from 158 days last summer to more than 200 last month. And even kids' surgeries, which once took 167 days, now have a wait time of 209. That new provincial data only shows surgeries that have been completed. Some warn with thousands more in the pipeline, the entire system needs to boost its capacity.
It would take a long time, years, for us to catch up on that backlog.
When you think about cancer cases, those are not things that you can just put off indefinitely.
At North York General, teams are trying to keep surgery patients flowing in and out.
So it was a huge effort to get all of those cases that were in the queue divided up and then prioritized. And then we tried to run 1 to 2 rooms a day, even during the heat of the pandemic, to address those needs.
How do we increase our capacity over the coming months? That could involve working on weekends, adding an extra hour shift to a surgical block of time.
In the meantime, Anacleto says worried patients like her just want updates on how long they'll have to wait.
If I knew I had a week, a month, a year, I think I would feel better just knowing that information.
Lauren Pelly, CBC News, Brampton.
The Summer Olympics were supposed to start tomorrow, but because of the COVID-19 pandemic, they're scheduled to start a year from today. Now, to mark the date, organizers held a ceremony in the host city of Tokyo. A short, low-key event inside a new national stadium. No spectators were attending this event. The head of Tokyo's organizing committee says the competition won't take place unless the current situation improves in terms of COVID-19. It's 6:29 p.m. and that's it for CBC Windsor News. Don't forget, for news at any time, you can go on our website, cbc.ca/Windsor. We're on social media too. You can check us out on Facebook, Instagram, and Twitter. Just look for CBC Windsor. Power and Politics is up next, already in progress. Thanks for watching. Make sure that you and your family have a great night.